Hello, my name is Stephanie Klein, and this afternoon I'm going to talk a little bit to you about Trach Care. First things first, as you already know as a nurse, the number one way to stop the spread of infection is wash your hands. It's the number one cause of spread of infection is unclean hands. Before getting started, the nurse should also observe for signs and symptoms of need for trach care. For instance, soiled trach care, soiled dressings, and poor circulation of oxygen. Okay, now let's get started. Step 1. Suction the trach at this time. Just perform normal suctioning. That should include inline suctioning with a sterile technique. And step 2 is to prepare your equipment. After you've suctioned, 2 is to prepare your equipment. This is a normal trach care kit. I do apologize, I do not have one with me, but I did make a copy of it. Open 2 packs of cotton tip swabs. Open sterile trach care kit, it's the little box. And wrap the sterile basin and pour 2 centimeters of hydrogen peroxide and normal saline, the same amount, 2 centimeters, into the little basin. Open the small sterile brush and place it aseptically into the sterile basin. At this time you will apply your gloves. Remember, sterile technique is a must. Now you will remove your oxygen source. I have a copy here. Your patient may be on just normal oxygen flow, or your patient may be on a vent. If your patient is on a vent, you can remove it. Make sure you 100% oxygenize your patient beforehand, but you can lay it loosely around the cannula. Step 3 deals with your inner cannula. While touching the outer aspect of the tube, remove the inner cannula with the non-dominant hand. This is your hand that you're going to make unsterile at this point. You're going to remove the inner cannula out and drop it into your basin of half normal saline and peroxide. At this time, once you have your inner cannula removed, just lay your oxygen supply, whether it be just regular oxygen or if it's on a ventilator, just lay it near there. Most tracheostomies, you cannot put the oxygen source directly over it at this time. It will not stay on. Just lay it loosely near it so they can get their supply of oxygen. Now remember, your patient will not have the same amount of oxygen at this time, so you have to move quickly. Once you do that, you're going to take your inner cannula in your basin, and you're going to take your swabs and your brush, and you're going to clean your inner cannula. And once you have it cleaned, you can tell if it's clean. You know, all the gunk will be laying in your basin. Take what's left of your normal saline and your peroxide, pour some normal saline over it, and then pour your, technical difficulties, sorry. Pour your normal saline over it just to rinse it. Now, at this time, replace it back into the inner cannula and make sure it's locked. I'll just set it here. When you feel it lock, you actually feel it when you put the inner cannula in. Also make sure you watch your technique of placing your inner cannula. Remember, the curved side goes up, twist in, and go down. and when you turn it, you can feel the little lock. You can feel the locking mechanism. Now also remember, if your patient has a Shiley, they're normally Shileys, those are disposable inner cannulas. In this picture I have them cleaning the cannula, and on this picture is just a inner cannula that is disposable. Now if it's disposable, we'll just remove it from the packaging. While touching only the outer aspect of the tube, withdraw the inner cannula. If you haven't already took the inner cannula out, withdraw it. We'll just replace the new one. It's just simple as replacing the new one. Make sure you lock it in position. Dispose of the old cannula properly in your recycling bin, and apply your oxygen source just like if you did the ones that are not disposable that you have to clean. At this time, you are going to clean the outer area around the cannula. You'll take your 4x4 gauze and your 4x4 swabs at this time that you did not use, and simply clean in a circular motion around, wiping from the inside outward. After you have that clear, you're going to secure your tracheostomy. Now your patient may have one or two sources of holding mechanisms. In this picture is a tie. Is this the trach tie? And in the other picture is a trach holder that comes in most kits now. Once you have your ties securely around your trach, you will then apply dressings around it. You have your drainage gauze. You will simply just apply it up around both sides of the trach. At this time, once you have everything in place, you can reapply your oxygen. Like I said, if it's a ventilator, it will snap back into place. If not, your patient may just be on an air tent or just some form of oxygen flow. Then you have completed your Trach Care. At this time, you will remove your gloves and perform basic hygiene. Again, the number one cause of spread of infection in the medical field is hand hygiene, so please make sure to wash your hands before and after. Also, at this time, you want to observe your patient. Your patient may be a little tachypnic just because of all the work, the anxiety of foiling or of working with a trach is kind of scary for your patient. So remember to calm your patient. You also evaluate the trach holder and the equipment for any redness, discoloration, any trauma that you may have done. And look for signs and symptoms of course, irritation. Because you have, that area will be sensitive, you don't want any irritation. So at this time, you have successfully completed Trach Care. I hope you've enjoyed my presentation, and I do apologize for the technical difficulties. Thank you.